Healthfront is a presentation of Medical Media Group and the following physicians and healthcare organizations.
Today on the American Health Front, we'll discover a new inpatient facility offering a unique approach to joint replacement surgery. We'll explore advanced techniques and treatments that's giving hope to people living with chronic pain. And stay with us as we learn how dentists can provide simple solutions to help patients with chronic snoring and obstructive sleep apnea. Hello everyone, I'm Ernie Bjorkman and welcome to the American Health Front. The purpose of our program today is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Chicago edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could really change your life. So stay with us, because there is nothing more important than your health.
Having focused on some advancements in medical fields, we now turn our attention to exploring what's new in the world of dentistry. First, a dental solution to sleep apnea.
Snoring is often characterized as being funny, but it can be a sign of a deadly disease known as sleep apnea.
I actually didn't think there was a problem. It was my wife that thought there was a problem. Snoring, keeping her up all night. She would constantly push and prod me.
Snoring and apnea are best treated by your sleep doctor and dentist working together. The standard medical treatment is called CPAP, but only about 1/3 of patients can tolerate it. Dr. Shapira has been treating sleep apnea and other sleep disorders for more than 25 years.
I became involved in treating sleep apnea because my 5-year-old son, Billy, had severe apnea. We actually had to hold him back from starting kindergarten. You worry about your kids when they can't start kindergarten. After we took care of his sleep apnea, he became a straight A student. Snoring and apnea are actually a collapse of the airway. As you breathe in, there's so much resistance that the airway just blocks up like a vacuum tube and closes down. Now what happens is you're literally suffocating over and over and waking up all night long. The number one sign of sleep apnea is loud snoring. Sleep apnea is diagnosed by polysomnography and the sleep physician. At the patient's first consultation with me, the sleep study results are reviewed and the information is used to determine which appliance will best suit this particular patient. Patients with untreated sleep apnea have a 36% increased risk of death over 8 years. I offer comfortable alternatives to CPAP. One of my favorites is the TAP appliance. It has a volume control for the bed partner's convenience. By titrating the screw, the snoring is turned off and the airway is opened. The appliance brings the jaw and tongue forward and stabilizes them. The vacuum of breathing no longer collapses the patient's airway.
My wife's reaction has been extraordinary. She actually sleeps, and it's interesting because not only do I feel better, she feels better. So we're actually getting along a lot better than we did before.
Dr. Shapira provides comfortable dental solutions for a good night's sleep.